Kids are almost heading back to the classroom and first day of school anxiety can be common, but there may be some other factors that can affect your child's mental health. I spoke with a licensed counselor and a primary care doctor about the importance of checking in with your kids. Those first day of school jitters can be pretty common among students, but Joycelyn Henry, the chief clinical officer at Wellstone, says kids have been through a lot.
Kids are resilient. They tend to bounce back from things, even things such as the things that's been happening in the world as it relates to school shootings, even the pandemic. They just are very resilient. But then there's the subset of kids who find it very difficult to move forward from such tragedies.
And these tragedies can have an impact on a child's mental health.
We see where there's poor academic performances, they're struggling with social issues, having some anxiety, some depression, and things of that nature. We know that it's very important to have open and honest conversations with kids when they're experiencing these types of issues of concern.
Henry says that when children are withdrawing and are not interested in activities they once enjoyed, it's a good time for guardians to check in.
As a parent or caregiver, to ask questions about how they're feeling and how they're doing, and then, if necessary, seek out the professional mental health providers in terms of assisting them through those times.
Dr. Channing Brown, a primary care doctor, encourages parents to set aside time for family dinner.
We know really can be beneficial for families and for children as they go back to the school year in terms of having times to connect and having times to be able to be there and have a listening ear for their child and provide support and also stay connected to their children as we go back into the school year and talk to them about important topics.
Dr. Brown adds that it's important for parents to discuss big transitions.
And let's say that your child is switching schools, going to college, switching from middle school to high school, or there's a divorce in the family or a recent death in the family, talking with your child's pediatrician or primary doctor about whether there would be resources or treatment options to help with them coping with these changes can be really helpful before they become a problem that's interfering with their daily life and their schoolwork.
And Henry shares that therapists from Wellstone are within several schools in Huntsville available for kids who need the support. Ultimately, Henry urges kids to
be okay with talking about how they're feeling, to be honest with what's going on with them. And it's okay to feel like you're not okay.